I'm going to, the other thing I want to touch on a little bit is your interest in emergency medicine, and I guess how that influences what you think about what family medicine is. And I'll give you, I'm just going to give you a little anecdote because you chaired the Committee on Emergency Medicine, and then I think Isser Dubinsky took over after you. And at the time, there was a huge debate within the college and at the board about whether emergency medicine was really family medicine and whether people who did it full-time could use that as practice eligibility for certification in family medicine. Because there were a lot of people who went into Emerge full-time from medical school. And I asked Brian Hennon about it because I remember Brian arguing eloquently that there's no way emergency medicine could count as family practice. And when I reminded him of that, he said, "Oh, I don't remember saying that." But it's one of the things that always struck me. And I know you have, one of the things you really see as important is the skilled clinician as one of the principles of family medicine, as opposed to perhaps some of the others and people. I just wondered if you could talk about that in relation to emergency medicine.
Sure.
Yeah.
Well, I never saw my own personal role in the emergency department as something that removed me from family medicine. As you know, because we worked together through many of those years, and through my role at the college in the Committee on Emergency Medicine, I don't think I'm off base in saying I was always a strong advocate of the family doctor's role in emergency as part of his or her practice. And I still believe that today. And the reality that supports that is that in all of the small and smaller communities, that's what happens. And at the time that I became interested in emergency medicine, it was even happening in the larger communities. And I was at a large teaching hospital in downtown Toronto that basically the family physicians were the ones who were the physicians in the emergency department. And we had an outstanding group there who provided very good service and formed the teaching department within the Department of Family Medicine for when the residency training program started. And we were also responsible for supervising and teaching all of the other residents from other disciplines who came through emergency medicine. And it was an exciting and opportune time for all of us. But I saw it as something that is part of the family physician's commitment to his or her community. The hospital work, and I think all of the in-hospital work, including emergency department work, is something that does provide benefit for the family physician to maintain his or her skills and even augment his or her skills that are carried over into practice, both through the kinds of clinical situations you're encountering, your interaction with other specialists who get involved in some of the acute care situations, and the need to continue to keep up in some of these that I think are only positive. And I always found that personally, if I was seeing a patient in the office who had a cardiac problem or a diabetic problem that was something on the verge of becoming something I saw in the emergency department or was presenting in the same way, I knew how to deal with it there. And it gave me great confidence in terms of what I could actually provide for my patient in terms of things I did at that moment or the advice I had to give them and direct them to what they needed. And I think that the loss of that for family physicians, the in-hospital role and the emergency department role is, I think, an unfortunate thing. I would still like to see that come back as gradually as it may happen in certain settings, that would be beneficial. I saw emergency as, I don't think emergency medicine is the same as family medicine. It has a lot of the skills that you need are similar and maybe even the same, a lot of. But it's a different context, and when I'd always refer through the rest of my career, and particularly when I became CEO of the college, because I'd get a lot of calls from people who knew me saying, I need a family doctor, and I'd refer them to the source that would give them names of family doctors who were in their community. And I'd get a call back saying, well, I called that doctor and he said he's an emergency physician. I need somebody who's going to take care of all my problems for me and my family. And I realized it's not the same thing, even though the the discipline of family medicine is actually very relevant to becoming a good emergency physician. And I think emergency physicians, even those who do it full time, and we have many in our college, benefit themselves and their patients benefit by them having had a basis in training and coming from family medicine and staying committed to family medicine and what family medicine stands for. But they need to also maintain skills in an area, if that's all they're doing, that is appropriate to that context. And I think emergency medicine now, that it's delivered by a cadre that includes those who now have the opportunity to do Royal College full-time emergentology training and practice in that way, mixed with people who've done our training and got a certificate of special competence in emergency medicine. I think they can all provide excellent care. I would still prefer to see most people who do it through family medicine combine it with their practices, and I strongly believe that the hospitals and the healthcare system should actually go so far as to making that a requirement, and they should be required to have some of those people on the staff of their hospital. People who are linked to a community-based practice and understand all of that, not just those who are doing full-time. But I do believe we can accommodate and support as a college those of our colleagues who have decided personally to make it full-time but come from a family medicine background. We have a lot to offer them. We gave them a strong base through their family medicine training. They are good doctors. They're benefiting their patients. Many of them remain committed to the principles of family medicine. But for the future, I think we should be telling medical students and those in training that they have a choice to make. That basically if they want to do just full-time emergency medicine, they should really think seriously about the Royal College program and become emergentologists. But if they want to include emergency medicine as part of what they do as family doctors, which I really think is worthwhile, do it through our programs, either through your core family medicine, after which many people are capable of going out and doing emergency medicine, or taking the additional training to get a certificate of special competence, but include it as part of a broader base of practice and contribute as a family physician should to the broader context of care for patients.
Okay.